All right, I think we're set. Thank you. Good afternoon. Thank you again for joining us for the daily briefing on the City of Philadelphia's response to COVID-19. Today, all the speakers again are joining us virtually to adhere to social distancing guidelines. And today we will begin with opening remarks from Mayor Jim Kenney. Mayor.
Thank you, Mike. Good afternoon, everyone. I want to start today with a couple of important reminders. First, the School District of Philadelphia is continuing to loan Chromebooks to district K-12 students who need one for learning at home. Plenty of Chromebooks are available as the district begins its digital learning plan. There's no need to worry that they will run out if you plan your visit for later in the week or next week. So let me repeat that. The Chromebooks are still available, so there's no need to rush to claim one. 2 distribution sites are available for pickup Monday through Friday from 9 a.m. to 4 p.m. Monday through Friday, 9 a.m. to 4 p.m. Parents and students can go to the district's education center at 440 North Broad Street or the Fitzpatrick Annex building in the back of Fitzpatrick Elementary School in the Northeast. Adults who are picking up for their student should bring some form of personal identification. It is also recommended, but not necessary, to have the student's identification number. High school students who are picking up their own should bring their official school district identification badge. Since waiting lines are outside, please check the weather before coming so you can make an appropriate decision. The second reminder also to students and families is about student meal distributions. Beginning this week, the School District of Philadelphia's 49 meal sites will only give out meals just once a week on Thursday mornings. It's once a week on Thursday mornings. These sites will now give out 5 days worth of breakfast and lunch for each student. That's 10 meals per child. We encourage families to prepare for carrying home more meals by bringing a sturdy bag or some type of cart. This change only applies to School District Philadelphia sites. Other student meal sites, such as charter schools and Philadelphia Parks and Recreation sites, continue to operate on their normal schedule. The city-supported sites for food boxes will continue to offer pickups on Mondays and Thursdays. Finally, I want to note that the city today has reached a rather sobering milestone. For the first time, the number of confirmed cases of COVID-19 in Philadelphia has exceeded 10,000. Dr. Farley will have more details in a few minutes. I recognize that hitting 10,000 cases in our city is hard and it's very scary. We all feel that. But my message now is simply thank you. As I look around the city, my home, I see hundreds of thousands of people, Philadelphians, doing everything they can do to keep others safe along with themselves. We are feeding each other. We are staying away from each other. We are wearing masks and we are doing what needs to be done. So thank you. Thank you most importantly to the hospital and healthcare workers caring for all of us. Each of you is a hero and we will never be able to repay that. Thank you as well to our first responders, our police and fire departments, protecting us and keeping us safe. Thank you to our essential personnel keeping the city running, including the police and fire departments, the health department, emergency management, and the streets and sanitation department, and many more. Thank you all. Thank you to all the other essential workers out there, those working in our grocery stores, pharmacies, and restaurants, and the folks who are delivering goods to us every day. And thank you to each of you who are watching and listening. Thank you for staying home, for listening to what the doctors have been telling us, and for taking care of each other. And now, Dr. Farley, please.
Thank you, Mayor. As the Mayor said, we have hit now this sad milestone of 10,000 cases here in the city of Philadelphia. I'd like to say that we're finished with this, but unfortunately that number is going to continue to grow. That's an awful lot of cases. The first case we confirmed was 6 weeks ago, back on March 10th. So it's been quite a ride for those past 6 weeks. I'm hopeful, though, that we are near the worst of this and that we'll get better from here. Not at the worst, but near the worst of this. So here's more details. As of today, we have diagnosed 475 new cases in the city of Philadelphia, bringing us to 10,028 total. Now, some of this is just identifying previous cases where the county of residence was unknown and have been classified in the city of Philadelphia. But most of those are new cases. Now, we see daily fluctuations in the number of new cases, but overall, this 475 is about average for what we've seen in the last week or so. So the fact that we're more or less level over the past week is good. It means that the increases we've seen in previous weeks have stopped. By the end of this week, I hope to say if we are seeing decreases. I should say, when we start to see decreases, any decrease is good, even a small decrease. That's a sign that we're winning over this epidemic and that decrease should continue. If you want to see more about the trends for this, check our graph on the website. Now, we're continuing to battle clusters of this infection in congregate settings, particularly nursing homes that have been hit very hard, behavioral health settings, as well as the city's jail. So the city's jail now has 55 inmates with the infection. That includes 6 inmates who have tested positive newly and 7 others who have recovered. And that's, to put it in context, out of a total of about 3,800 inmates in the city's jail. I have to report today that sadly we have 24 new deaths to report, bringing us to a total of 394 deaths from coronavirus since the beginning of this epidemic. And that 24 new deaths is about average for the last week or so. I hate to really talk about this as numbers because each death itself is a tragedy. But the fact that we're at average and it is not increasing is a sign that we may be getting past the worst of this epidemic. If you want a better sense of trends, there's also a graph on our website that shows deaths by day. Of those deaths, 208 or 53% were nursing home residents. Now, as far as cases in hospitals, we had a data problem today, so I can't give you a count on how many patients are in our city's hospitals or in our region's hospitals. We do know that 31% of our general medical care beds, 28% of our intensive care unit beds are available. So we do have capacity in the system as a whole, but there are some individual hospitals that are at or near capacity. I talked to the chief medical officers of the hospitals yesterday, and they are transferring patients to other hospitals as necessary. Some of those patients have come to the Leah Core Center, and so the Leah Core Center is open, it's operating, and is taking care of a small number of patients. So we do think that we can manage through this. As far as testing, we still have a limited number of sites across the city where testing is available. Our criteria for testing are people over the age of 50 who have symptoms that are characteristic of this infection, or healthcare workers. If you want more information about where to go for testing, just go to our website, www.phila.gov/COVID, and there are links and phone numbers for the individual sites about how you can get testing done. Overall, I say that our level case count is a sign that we're making progress. We're no longer seeing the sharp increases that we saw in the past. Still, however, there are many cases that are occurring in the city, and preventing spread is mainly going to depend on people following our social distancing recommendations. So keep your distance from other people, stay home. If you have to go outside and you're around other people, wear a mask. More information, again, is on our website, www.phila.gov/COVID, or if you want medical questions answered, 1-800-722-7112. Now I want to turn it over to Reverend Naomi Washington-Leapart.
Thank you, Dr. Farley. Good afternoon, everyone. I first of all want to thank houses of worship around the city for shifting and adjusting to the guidance that we've offered so far. Every week I hear stories about how faith communities are supporting each other and supporting the city. So thank you for your leadership, for your engagement, and your cooperation. The holy month of Ramadan will begin approximately on April 24th. Ramadan is a time of spiritual rejuvenation and deep contemplation of one's relationship with God. And during this entire month, Muslims commemorate the revelation of the Quran, fast every day from dawn to sunset, and increase acts of worship, such as prayer, reading, and study of the Quran, and giving charity. At sunset, Muslims break the fast with a very light meal, pray, and usually get together with friends or family for dinner. Muslims worldwide also celebrate 2 religious holidays annually, the Eid holidays. The Eid celebration is typically the largest gathering of Muslims in any place, any locality. Eid al-Fitr literally means the festival of the breaking of the fast, and it marks the end of Ramadan. I want to offer Muslim communities in our city some special guidance for observing Ramadan and Eid during COVID-19. I want to thank Salima Suswell, the founder and executive director of the Philadelphia Ramadan and Eid Fund, and Sheikh Dr. Tahir Wyatt, the director of Islamic education at United Muslim Masjid, for writing this guidance for us. The need to maintain social distance due to COVID-19 means that Muslims will not be able to congregate in the mosques during Ramadan as they normally would. They will also not be able to eat in the large groups that are typical of this month. The Muslim community in Philadelphia is cooperating to make sure that all Muslims have something to eat at sunset and that they don't feel isolated because of this situation. The most important aspect of Ramadan, increasing God consciousness, can be attained despite social distancing limitations. In fact, in many ways, Muslims may find this to be an opportunity for great spiritual growth. As long as they endure this trial patiently, Muslims believe that they will have a special reward from God. The Quran states, "O you who believe, seek my help through patience and prayer. Surely Allah is with those who are patient." In light of the coronavirus pandemic, the Philadelphia Ramadan and Eid Fund has made the tough decision to cancel the Philly Eid in the Park Festival, the city's largest Eid convening. Last year, over 15,000 Muslim community members attended. But the organization has designed an alternative experience for families through their new Eid al-Fitr Meals on Wheels and Family Fund program. So on Saturday, May 30th, the Philly Ramadan and Eid Fund will provide 100 families with dinner and a personalized gift basket. Registration for this program opens this Friday, April 24th. And for more information, you can follow Philly Eid in the Park Festival on social media or contact them at contact@phillyeidinthepark.org. I just want to reiterate that we're asking all faith communities to refrain from gathering in person until further notice. Please remember that no risk is better than minimal risk. This is a time to imagine and innovate, a time to worship safely, not worship less. And I want to say that I understand how challenging and even painful this can be for people of faith. Please be assured that our patience will not be in vain. If you need support, you can email me, Reverend Naomi, at faithphl@phila.gov with your questions or your concerns. We are still hosting prayer pauses every Friday, Saturday, and Sunday at 3 p.m. You can check the Facebook page of the Mayor's Office of Public Engagement for those live prayer pauses. Best wishes for a peaceful and blessed month of Ramadan, and may you all be healthy and whole. Thank you.
Thank you, Reverend. Reverend Naomi Washington Leapart is the city's director for faith-based and interfaith affairs. And now we'll turn things over to Armando, who will provide this Spanish language translation.
Mensaje del alcalde Jim Kenney para el martes 21 de abril del 2020. Buenas tardes a todos. Comienzo el día con dos recordatorios muy importantes. Primero, el Distrito Escolar de Filadelfia que necesitan una computadora para continuar con sus estudios desde casa. Hay 2 sitios de distribución disponibles para recoger las computadoras de lunes a viernes de 9 de la mañana a 4 de la tarde. Los padres y los estudiantes pueden ir al District's Education Center en el 440 de North Broad Street o al edificio anexo Fitzpatrick en la parte trasera de la escuela primaria Fitzpatrick en el noreste. Los adultos que recojan las computadoras a nombre de sus hijos deben proporcionar algún tipo de identificación personal. También se recomienda, aunque no es necesario, traer consigo el número de identificación del estudiante. Los estudiantes de secundaria que recojan sus computadoras en persona deben traer su identificación oficial del distrito escolar. Si planifica su visita para el fin de semana o para la próxima semana, no se preocupe. Hay muchas Chromebooks disponibles. Debido a que las colas se hacen fuera de los edificios, les sugerimos también verificar el clima antes de salir de su casa. El segundo recordatorio, también para los alumnos y sus familias, es sobre los centros de distribución de comidas para los estudiantes. A partir de esta semana, los 49 centros de comidas del Distrito Escolar de Filadelfia solo distribuirán comidas una vez por semana, los jueves por la mañana. Estos sitios ahora ofrecerán 5 días de desayuno y almuerzo para cada estudiante, es decir, 10 comidas por niño. Les sugerimos buscar sus comidas llevando una bolsa o carrito resistentes. Este cambio solo es para las escuelas del Distrito Escolar de Filadelfia. Otros sitios de comidas para estudiantes, como las escuelas charter y los sitios del sistema de parques y recreación de Filadelfia, continúan operando en su horario normal. Los centros de alimentos respaldados por la ciudad continuarán ofreciendo comidas para llevar los lunes y los jueves. Para concluir, tristemente, hoy la ciudad ha alcanzado un hito bastante preocupante. Por primera vez, el número de casos confirmados del COVID-19 en Filadelfia ha superado los 10,000 casos. Llegar a 10,000 casos en nuestra ciudad es algo difícil y aterrador, y todos lo lamentamos. Pero al ver a nuestro alrededor, vemos a cientos de miles de personas haciendo todo lo posible para mantener seguros a los demás. Nos ayudamos mutuamente, mantenemos la distancia social, nos ponemos máscaras y hacemos lo que hay que hacer para mantenernos seguros. El mensaje de la ciudad para todos ustedes es gracias. Gracias a los trabajadores de la salud que nos atienden. Gracias a cada uno de ustedes que es un héroe, porque nunca les podremos repagar por todo esto. Gracias también a nuestros socorristas, a los policías y bomberos, a aquellos que nos protegen y nos mantienen seguros. Gracias a nuestro personal esencial, que mantiene la ciudad en funcionamiento. Gracias a todos los demás trabajadores esenciales que existen. Los héroes que trabajan en nuestros supermercados, farmacias y restaurantes, y a las personas que nos entregan productos todos los días. Gracias a cada uno de ustedes que está mirando y escuchando diariamente estas conferencias, por quedarse en casa, por escuchar lo que los médicos nos han estado diciendo y por cuidarnos unos a otros. Juntos superaremos esta tormenta. Y esta es la actualización en materia de salud el martes 21 de abril de 2020. Comenzamos el día de hoy anunciando un triste hito. Hemos sobrepasado los 10,000 casos del coronavirus en Filadelfia. Desde ayer se han confirmado 475 nuevos casos de coronavirus en Filadelfia y actualmente tenemos un total de 10,028 casos en la ciudad. En general, tenemos un recuento de casos promedio, similar al de la semana pasada, y esto es bueno, ya que significa que no se ha incrementado el número de casos. Esperamos anunciar al final de la semana que los casos estén ya disminuyendo. Tenemos 6 casos positivos de COVID-19 entre los reclusos, con un total de 55 casos registrados y hay 7 internos que se están recuperando satisfactoriamente. Tristemente, sin embargo, reportamos 24 nuevos fallecimientos en Filadelfia. Hay un total de 394 personas que han muerto ya por la COVID-19. 208 de estas muertes, es decir, el 53%, se han producido en hogares de ancianos. Este virus no discrimina por raza o por género. Los hospitales están monitoreando el aumento de los casos, aunque hoy hemos tenido un problema con el conteo de pacientes hospitalizados y no podemos proporcionar esos datos. El 31% de las camas en los hospitales y el 28% en las unidades de cuidado intensivo se encuentran aún disponibles en la región. El La Cura Center está funcionando y atendiendo a un número pequeño de pacientes. El número de pruebas que podemos hacer es limitado debido a la escasez de hisopos para recolectar las muestras y a la capacidad limitada de procesarlas que tienen los laboratorios. Pero usted puede encontrar mayor información sobre los centros de pruebas visitando fila.gov/COVID-19 en la pestaña FAQ. En general, todo indica que estamos progresando. Sin embargo, hay todavía muchos casos en nuestro entorno. Por lo tanto, la mejor recomendación en estos momentos es de prevenir la propagación del virus manteniendo la distancia social porque el virus sigue circulando en nuestro ambiente. Si debe salir a trabajar o al supermercado, le recomendamos mantener la distancia social de 6 pies, usar máscaras de tela en lugares públicos donde sea difícil cumplir con las medidas de distanciamiento social, lavarse las manos apenas llegue a casa. Le invitamos a consultar el sitio web para mayor información, www.fila.gov/COVID-19. Recuerde usted que puede llamar al 311 si tiene preguntas sobre el COVID-19. Hay servicios de traducción disponibles en 100 idiomas. Y si tiene preguntas de carácter médico, puede llamar las 24 horas, los 7 días por semana al 1-800-722-7112 y esta llamada es gratuita. El mensaje de la reverenda Naomi Washington Leaphart, directora de Asuntos Religiosos e Interreligiosos de la ciudad. El mes sagrado de Ramadán comenzará aproximadamente este 24 de abril. La necesidad de mantener la distancia social debido al COVID-19 significa que los musulmanes no podrán congregarse en las mezquitas durante el Ramadán como lo harían normalmente. Tampoco podrán comer en grandes grupos como se acostumbra durante este mes. La comunidad musulmana en Filadelfia está cooperando para asegurarse que todos los musulmanes tengan algo de comer al atardecer y que no se sientan aislados debido a esta situación. El aspecto más importante del Ramadán se puede lograr a pesar de las limitaciones impuestas por el distanciamiento social. De hecho, de muchas maneras la comunidad musulmana puede encontrar que esta es una gran oportunidad para un crecimiento espiritual. Debido a la pandemia del coronavirus, el Philadelphia Ramadan and Eid Fund ha tomado la difícil decisión de cancelar el Philly Eid in the Park Festival, una convocatoria a la que el año pasado asistieron más de 15,000 personas de la comunidad musulmana. La organización ha diseñado una experiencia alternativa este año para que las familias, a través de su nuevo programa Eid al-Fitr, Meals on Wheels and Family Fun, se dé este sábado 30 de mayo. El fondo de Philadelphia Ramadan and Eid Fund les brindará una cena a 100 familias, preparada por la compañía Southside Savannah Halal Eatery, junto con una canasta de regalo personalizada. La inscripción se abrirá este viernes 24 de abril. Para obtener mayor información y actualizaciones periódicas, siga a Philly Eid in the Park Festival en las redes sociales o envíe un correo electrónico a contact@phillyeidinthepark.org. Gracias.
Great. Thank you, Armando. We're going to now begin the Q&A portion of the daily briefing. If you have not done so already, please add the name of your media affiliation to the login name in the Zoom conference. We also ask that you upload a photo or a company logo to your profile for broadcast purposes. And again, if you'd like to ask a question, please use the raise your hand function, which is listed under participants, and then we will unmute your microphone when we begin the Q&A. As usual, we have limited time for these briefings, so please limit your questions to 1 to 3, to the 3 most important that you have, and we'll start off with Jeff Cole of Fox 29.
Yeah, just a few questions. First for Brian Abernathy. Brian, we're covering the 4-year-old child shot in the abdomen and killed. I know the police department has made a release issued a release with more details now. Can you speak to that release? What does the city know about this child's passing overnight?
The investigation is ongoing. We are aware that there were 4 adults in the home at the time of the shooting. There was a .357 revolver that was found on the scene, I believe in the living room sofa, and that revolver had 5 live rounds, and there was 1 round or 1 spent cartridge. It was determined that it was very difficult for the child to have shot herself, and that the shot did originate from inside the house. And so those 4 adults are currently at our homicide division being interviewed, and hopefully we are able to determine the cause and exactly what happened in the near future. And I think the one thing this is an absolute tragedy, and it's hard for us not to think about our own kids when something like this happens. And I think it does just highlight really the importance of gun safety, of making sure that guns are unloaded when they're stored, that we take the opportunity to use our gun locks, and if folks don't have gun locks, to contact the sheriff's office to get those. We're certainly aware that a number of folks early on, we saw lines outside our gun stores. I think the mayor was very clear in his feelings about that, but certainly people bought firearms and make sure that those firearms are stored appropriately, and people remember gun safety as well is key. And as far as this instance specifically, it's under investigation, and my thoughts and prayers just go out to that family and remember her living his life.
For the mayor, if I could. Mayor, through the end of last year and into this, there appears to be a spate of shootings involving children. Your new police commissioner will be on the job now 3 months, I think, beginning when May 10th. I think she started in February. Mayor, have you asked Commissioner Outlaw to institute a new violence prevention program in any way? Have you talked about that with her? Is that something that's coming down the pike, considering what appears to be children being victimized and 117 homicides, up 17% over last year?
Well, we had a robust violence reduction plan in place before she even arrived here. Part of the difficulty with that, it is centered around interaction with people who are most likely to shoot or be shot. It is that kind of intervention, plus the offering of resources and services, job training and jobs. And sad to say that a lot of that is not available any longer because of the pandemic. And the ability to interact and interface with these folks, with our workers, is difficult because they're worried about their health, and the interactions are difficult. In this particular case, it's extremely difficult to police something that happens in a home. Obviously, if things are on the street and we can redeploy our police and our violence workers to those areas. But if something happens like last night in a home, it is extremely difficult for us to have a policing strategy to keep that from happening. As Brian said, people need to be responsible with their weaponry. There's too many guns in our society to begin with. You saw, as he said, you saw the lines at gun stores. I don't know if this is related, but the point is that this happened in a home, and we are just devastated by it. Any 4-year-old, any person would feel this way about the loss of a child. But we're dealing with the pandemic and dealing with the issues of violence, and we're going to get there.
Let me just then my final third question. I mean, admittedly, yeah, there's a pandemic, so it did undercut the prior program, as you have said. Is there not a different way then to try to mitigate violence, in that you can't go about the old way because of what's happening?
Well, we're working on those strategies now. At the same time, we're juggling the other 12 balls in the air that we're dealing with as it relates to COVID-19. And we will have some, and then we have to deal with our budget, which will be reintroduced on May 1st. So all those factors impact on that. We're doing our best with what we have, and hopefully we can make it better.
And I just want to add, Jeff, certainly our community crisis intervention teams are continuing to engage in our communities. We have continued to increase our police officers in our communities as well. Deputy Commissioner Singleton, who's recently been promoted, has been charged with making sure that our deployment strategies meet the violence as well. Commissioner Outlaw, her entire leadership team, the entire department are focused on this issue, as is the entire administration. We had an epidemic of gun violence when we started this pandemic. We still have an epidemic of gun violence, and we're not going to rest until we are able to stem the tide going forward.
Thank you.
Thank you, Jeff. And next up is Mitch Blocker of NBC 10.
Thank you. This couple of questions for Dr. Farley. Dr. Farley, you've talked a lot about the lack of testing supplies as a major problem. How much of the population do you need to test before you'd be medically comfortable reopening?
The reopening would probably take place in stages, and we may be increasing our testing accessibility in stages. Let me give you some general sense of numbers now, though. We're testing about 1,200 to 1,500 Philadelphia residents per day. I would love to test at least 5,000 per day, maybe 10,000 per day, to feel like we're getting as many people as possible with this infection identified, so we can do the contact tracing and the rest of the work and follow up to that.
And where are you trying to get testing supplies? What have you ordered?
We have ordered the health department deals with the swabs themselves, what you collect the sample with. And so we've ordered those from the sources we ordinarily order those from, medical supply houses, I imagine. We've ordered, I remember for one of them, we ordered 10,000 and we got 500. So that's the example, is that the companies are rationing these because there's more demand and they can produce. There's another major limit too, and that is the chemicals that are used by the laboratories themselves. Those laboratories are all across the city and around the country. The city has its own laboratory, but our laboratory is a small fraction of the total testing around the city. And so all of those laboratories are likewise ordering these chemicals and are having similar problems getting access to those chemicals.
And I'm curious, one last thing. Have you considered using non-FDA approved tests?
There's different types of FDA approval. I'm not clear on all the details of it. I know that the tests that are the test for the virus itself, using a technology called PCR, those we feel are accurate enough to use, and we're happy to use those. I'm not sure if all of them get full FDA approval, but for example, some hospital laboratories may not have full FDA approval, but we feel confident enough in their results to rely on those. However, these separate tests, these antibody tests, there are many of those that are out that are not FDA approved and we do not think are reliable. Even if they are reliable, it's unclear how to interpret the antibody results. So we're not recommending those as a way of addressing the crisis right now.
Thank you, sir.
Thank you, Mitch. We go next to Cheryl Spreitzer of 6 ABC.
Oh, can you hear me? So the
Yes,
first question is for Dr. Farley. We are hearing that some hospitals are dealing with shortages of beds, ICU beds, but we're also hearing of staff shortages. Can you address that at area hospitals?
And the hospitals that are more full than others are having some limitations on staff, particularly intensive care unit nurses are what is in most short supply. And so in some cases, there may be hospitals that literally have a vacant bed, but they cannot provide the staffing to support a patient being in that bed. We're talking to all the hospitals on a regular basis. And if they can't handle the patients that are in there, we're encouraging them to transfer patients to other hospitals. There is enough capacity in the city to take care of those patients. And so with those transfers, we think we can handle the problem.
How many patients are currently at the Leocor Center?
As of 11 o'clock this morning, there were 4. That number is going to change on a day-to-day basis and maybe on an hour-to-hour basis.
And then my final question is for the mayor. In terms of the grab and goes with the school district, is it scaled down to 1 day a week because of a staffing shortage, or what was the reasoning behind moving that to a 1 day?
I'm personally not really sure. I think Brian would probably have. I was announced today. I'm not sure exactly why we've gone to 1 day, but apparently there's efficiencies that can be attained by going to 1 day.
Yeah, and the mayor's exactly right. It was really around efficiency, being able to pack up 1 box rather than 2, and also allow people to come out of their homes to pick up those boxes just once during the week rather than twice. Again, the same amount of food is being distributed. It's just being distributed on 1 day rather than on 2.
Okay, that's it. Thank you, guys.
Thank you, Cheryl. Charlene Santiago of Univision has questions. She's up next, but she is having technical problems. So we are going to ask our own Irene Contreras-Reyes to read Charlene's questions for translation. Thanks. Irene?
Sí, buenas tardes. ¿Me escuchan? Can you hear me?
We're good.
Okay. Estas preguntas van a ser para Brian. La primera pregunta es, estamos conscientes que los robos en locales comerciales han aumentado y fue mencionado el día de ayer, pero ¿ha habido alguna actualización desde entonces en términos de conversaciones con corredores comerciantes, con los corredores comerciales?
The first question is for Brian. We're aware that there's been commercial burglaries that have gone up, and this had been mentioned yesterday. Has there been any update in terms of conversations with the small business owners in the corridors, the business corridors?
We have not been able to organize those conversations yet. Again, the data that the police has not shown an increase in commercial burglaries. I know that's contrary to the district attorney, but I am not aware of what data the district attorney was looking at. I can only speak to what the police have.
Por el momento no hemos podido organizar estas conversaciones con los comerciantes todavía. Pensamos hacerlo. En estos momentos los datos que nos entrega la policía no muestran un aumento en el número de robos a los negocios. Y esto contradice las cifras que tiene la fiscalía, pero no sabemos a qué cifras está refiriéndose la fiscalía en ese sentido.
Muchas gracias, Armando. Y la segunda pregunta es, ¿qué protocolos de seguridad está tomando la ciudad cerca de estos corredores comerciales o ubicaciones de pequeñas empresas en la ciudad? También para Brian.
This question is also for Brian. What measures is the city contemplating, or what security protocols are being put in place for these commercial corridors in the city?
Again, we haven't seen crime increase in those commercial corridors. We are aware that there are some anecdotal incidents and are continuing to patrol and work with all of our residents to make sure that we tackle those incidents to the best of our ability.
Como dije anteriormente, no hemos visto un aumento del crimen en esas áreas. Conscientes, sin embargo, de que hay reportes anecdóticos de ello Vamos a continuar patrullando esas áreas de la ciudad y vamos a trabajar con todos los residentes de la ciudad para...
Thank you, Brian. Gracias, Armando.
Gracias.
Irene, were there more from Charlene?
Yes, we are good. Thank you, Mike.
Okay, thank you. And thank you, Charlene. Next is Alicia Reed of CBS 3.
Hi, this question is for Mayor Kenney. We're following the 4-year-old that was shot and killed here. Are there any additional concerns that you may have about children being at risk of violence while being quarantined in their homes?
I'm always worried about children being at risk of violence in their homes or on the street, and adults the same way. If you're in a private residence, it's very difficult for the police to police that situation when someone has a gun in their house and apparently it's not in a safe place. The investigation is still going underway, so don't know exactly what happened last night, but I worry about children and our adults all the time. It's just a very difficult thing with so many guns in the possession of so many people.
My second question is for the mayor or the health commissioner. The Inquirer published photos of bodies from Einstein Hospital being delivered to the medical examiner's office on a flatbed truck. Was this city procedure to have the bodies received in that manner? And is there an investigation into how and why this occurred?
Before Dr. Farley, I just want to say that this is extremely distressing. The visual was extremely distressing. When we talked about fatality management, one of the things I said to all the people running our departments is I want people to be treated with dignity. They're human beings, they're family members of people, and that is unconscionable what happened. The city medical examiner had a very stern conversation with the hospital involved, and we expressed that this is not acceptable and we don't want to see it ever happen again.
Yeah, I don't know how much to add to that. It's a terrible occurrence. It absolutely should not have occurred. There are protocols to make sure that doesn't happen. And yes, absolutely, we are talking to the hospital to make sure that that never happens again.
Thank you. My last question is about SEPTA. SEPTA's union has threatened a work action on Thursday should SEPTA not agree to some of their additional demands over safety. Is the city involved in helping to resolve this matter before a potential service disruption?
Our very effective Deputy Mayor of Labor, Rich Laser, is involved in the conversation, and he's hopeful that something could be worked out before then. And Brian, if you have anything else to add, please.
No, certainly that we're also making every contingency plan necessary should that strike occur to make sure that our healthcare workers and first responders can get to work and do what they need to do to make sure that all of us stay safe.
You good, Alicia?
Thank you. That's it. Thank you.
Yep. Very good. And next we go to Pat Loeb of KYW.
Thank you, Mike. Dr. Farley, you've said that whatever the number of confirmed cases is an indication that there are many more in the city. Is there any algorithm by which you can estimate the total number of cases if there are 10,000 confirmed cases?
There's no algorithm out there. I would certainly expect it to be many times the number of cases we're actually seeing. I think we're diagnosing less than half, maybe less than a third of the cases that are out there. We're not even testing people who are otherwise young and healthy who may have these symptoms, and we're certainly not testing people who have no symptoms or having mild symptoms. But if we're testing a consistent fraction of the people out there, then at least the graph that we're seeing every day gives us some indication of whether this epidemic is getting better or worse. So the fact that it's level right now, I think, is probably an accurate conclusion, even if we're getting only a small fraction of the total cases diagnosed.
Okay, thank you. And then I'm not sure who this is for. Of the victims who have died as a result of the virus, have all of their bodies been claimed and disposed of? Will there be any need for the city to bury some of them itself?
So people who have died of this virus are treated as people who die of any problem in the city of Philadelphia. So if they, generally speaking, families are involved. To the extent they're not, then the medical examiner works to find the next of kin. There's lots of effort to try to identify the next of kin. Ultimately, if a long period of time has gone and much effort has been put in identifying the next of kin and we still can't find someone, then the city can figure out a way to bury the body. But the vast majority of them we can find the next of kin and deal with the proper burial procedures.
So there are a few. Maybe.
I don't know whether there are so far in this epidemic.
But even
again, they're best to deal with all the time.
Even before the pandemic, we had situations where people went unclaimed. So it's not something that's new. It may be potentially more this time because of so many people passing away, but we've always had that situation where folks were remained unclaimed and then we had to bury them with some dignity.
Okay, thank you very much.
Great, thank you, Pat. And now we go to Yaima Crespo of Telemundo.
Esta pregunta es para el alcalde y el Departamento de Salud también. Ya la contestaron, pero me gustaría la respuesta en español. Es sobre esos cuerpos que fueron trasladados detrás de una camioneta. ¿Cuál es la reacción de la ciudad y el Departamento de Salud, ya que son imágenes muy gráficas?
This is a question that goes to the mayor and the health department, and I know this question has already been answered, but I want this for the Hispanic audience. This is in regards to the bodies that were transported with a pickup, behind a pickup, and this is very distressing images. What's the city doing about that?
We just said what we're doing about it. The medical examiner has had a very stern conversation with the hospital involved, and these protocols they need to follow. And so this doesn't happen again. I mean, it was distressing and unconscionable that we saw this, and the people who were formerly alive are now being treated disrespectfully. And we will monitor the situation and make sure it doesn't happen again.
Y esta respuesta ya la dimos. Estamos en contacto con la oficina del médico forense y también con los hospitales y el lugar donde se dio esto en particular para que revisen sus protocolos de manera que se trate a estos cadáveres y a, obviamente, los miembros de sus familias con el respeto que se merecen, para que puedan hacer las labores de una forma respetuosa, y vamos a seguir monitoreando esta situación.
Y en términos de los fondos federales que se le pidieron al gobierno y a la Casa Blanca, ¿han recibido respuestas? ¿Tienen alguna noticia de las autoridades federales?
And this is in regards to the funds that were requested from the White House and the federal government. Has there been any response in terms of the request for funding?
Take it. Brian on?
Oh, I'm sorry, Mayor. I thought you were going to take it. So we have seen some progress on the CARES Act 3.5 that is being currently negotiated in Congress that could increase the amount of reimbursement available from FEMA, as well as allow us to spend some of the U.S. Treasury dollars on lost revenue. And we're also aware that Congress has already started to discuss a CARES 4, which may begin to be negotiated towards the end of the month or early May. And so continue to work with the White House and our congressional delegation to make sure that we have direct revenue support going forward.
And the key is flexibility. A lot of times federal dollars come with strings attached and certain parameters you can't spend outside of. The more flexible the dollars are, the more effective it'll be for our recovery.
La respuesta viene tanto del alcalde como del gerente de la ciudad. Estamos observando el avance de esta iniciativa de la ley CARES Act 3.5 que está siendo negociada en el Congreso. Y por supuesto queremos ahí que se dé un aumento a los fondos disponibles a través de FEMA para poder disponer del dinero también del Tesoro por los ingresos que se han perdido. El Congreso también está trabajando en una versión nueva de la ley que es CARES 4, y al final del mes o a principios de mayo creo que va a haber un avance en esas negociaciones, y nosotros estamos trabajando con nuestra delegación congresal para poder tener acceso a esos fondos. El alcalde indica también de que la clave para todo esto es la flexibilidad, porque muchas veces esos fondos vienen atados a ciertos propósitos específicos, que hay que seguir trabajando, monitoreando en ello y esperando que nos den los fondos con la flexibilidad necesaria.
Y por último, en el caso de la menor baleada mortalmente, ¿qué tan preocupante es que sigan ocurriendo estos crímenes en medio de una pandemia donde la gente está supuesta a estar dentro de sus casas?
And the last question has to deal with a young girl that was shot to death. And it's so worrisome that we should have this incident in the middle of a pandemic when people are supposed to be staying at home.
We are in total agreement. It's it's horrible what happened. And one thing I could tell folks that if you suspect a child is in danger, you suspect a child is in an abusive situation in your neighborhood or on your street, the hotline is there to take that information at 215-683-6100. It's 215-683-6100. Our children depend on all of us to look out for them, and we need the information of what may be going on in a bad way.
Nosotros nos preocupa también extremadamente que esto haya sucedido. Estamos de acuerdo con usted en esta observación y nosotros tenemos una línea de reporte cuando se ven casos de abuso o de peligro para los niños, ya sea en su casa o en las calles, que es el 215-683-6100, 215-683-6100, y vamos a tratar de hacer lo que nos corresponde, que es velar por la salud y el bienestar de nuestros niños.
Muchas gracias, es todo.
Thank you.
Thank you, Armando and Naima. Next is Brian McCrone of NBC 10.
Hello, everyone. Dr. Farley, I want to ask you specifically two things. The first one is about antibody testing. You mentioned this earlier. I just want to follow up with a couple more questions about that. Are you saying the city are they doing, so you guys aren't in the antibody testing right now?
There may be some hospitals or some clinics that are doing antibody testing. We're not recommending that because we don't trust all of the tests. And even the tests that are well done, we don't know how to interpret the results. We can't guarantee if someone is told that they have antibodies that they are immune. We're afraid people may think that they're immune and then go out there and just expose themselves and become infected. So we need to know a lot more about individual tests and then even how to interpret the best test before we can recommend that people use it for an individual basis.
Okay. Now, do you have any? So you're gonna like, what is the idea? Like, what's the waiting game? How long do you think that might be?
I think it's going to be at least weeks and perhaps months before we really know how to interpret these antibody tests. So it's in more, I would think of as a research mode than it is something which is out there for people to use for the individual decision making.
Okay. And then the second one is, I was talking to an epidemiologist yesterday, the chair over at Temple of the School of Medicine. He says that, and his belief is that, I brought up how there's about 40,000 deaths nationally. In Pennsylvania, it's about 1,200 plus. In Philly, as you already said, it is what it is. But he thinks that the number could be double what is being reported publicly. And I wanted to see what you thought about that. And do you think it is double the amount that we're public, or where do you think that the actual official number is? And do you think it's going to grow based on finding out more people are dying from it than we actually realize?
It is possible that there are people who are dying and that we don't have a diagnosis of coronavirus. Let's say someone has bad heart disease and they die. Someone may think, well, the heart disease is what killed them. But in fact, they had the virus and they didn't have symptoms and they were not tested. So there may be something like that. I can't say how much additional deaths there may be, but that's definitely possible.
All right, thank you, Brian. And now we're going to Jason Peters of Philly Weekly.
Hello. Question number one, how accurately do you feel the numbers that we have on coronavirus are without the ability to test people who are asymptomatic, young, and not necessarily at risk?
We know that we're only identifying a fraction of the people who have this infection in the city because of many people, as you point out, that we are not testing. So the numbers we're showing here are not in any way to suggest that these are all the people with the infection in the city. This is our fraction, but if that fraction is consistent, then we can still use that to track the epidemic's progress across the city.
Okay, second question. Is city leadership at all concerned about the risks posed by other states opening up early?
Sure. I mean, we're in one of the most populated regions of the country. And we're pretty much on the same page. All the state, New Jersey, Delaware, Pennsylvania, New York are on the same page, understanding that going too fast is going to be a disaster. But I am worried about states like Georgia and Florida and interaction with the folks who are living there and not practicing safe practices and not having the government continue to tell people to wear masks and social distance and all the other stuff. But Doctor, I'm sure, has a more enlightened view.
we are concerned about that. If any place has an epidemic wave, then every other place is at risk. And so we at least need to be talking to our partners in the immediate area, New Jersey and Delaware, but really the entire part of the country, maybe the entire country, should be in coordination around this because of that risk.
Okay, and last question. With about 60 correctional officers testing positive for COVID-19, is there any conversation around granting them hazard pay?
So we have. So first of all, we're not confirming how many of our staff have been diagnosed with COVID-19 or not.
Oh, okay. Sorry, those are numbers I have.
No, that's.
Yeah, sorry.
Jason, you're fine. I think regarding our conversations with the union, I have engaged in conversations with DC 33 that represents our correctional officers, and those negotiations are ongoing. They're the last remaining contract for us to finalize and extend for the next year, and we're cautiously optimistic that we'll reach agreement in the near future.
All right, that's all.
Great, thanks, Jason. And next, and by the way, we're very close to running out of time, so we'll not have time today for a second round, unfortunately. But next we go to Sean Walsh of the Inquirer.
Thanks. I think most of mine have been asked, except Mayor, are you considering furloughs or layoffs of city workers in the near future, like anytime before your budget address or revised budgets on May 1st?
We'll be submitting our budget on revised budget on May 1st. We're going through department by department now with our finance and budget folks and the managing director's office. We'll have no comment until we're ready to trot it out.
Gotcha. Is furloughs or layoffs on the table though before the end of this budget year?
I'm not going to go any further as to what we're contemplating or what we're going to be forced to do until May 1st. I think it's council is a major player in this, and I'm not going to start making comments outside before they get a chance to look at the budget themselves.
Thanks. And then lastly, with the racial disparities among people who test positive for coronavirus that have emerged, what specifically is the city doing to address that issue? Are there, did it change the way it's approaching the pandemic once that became evident?
Well, we've been doing outreach to our Black and brown communities throughout the city. We've been using the clergy to help with that. We've been sending special mailings in certain zip codes where we believe we're reaching people we need to reach, and continue to advertise on radio and print ads that are prevalent in particular ethnic racial communities, and just trying to get the word out, especially to folks who are more susceptible to having some bad outcomes as a result of getting the virus. Doctor, do you have anything?
No, that's it. Really getting the message out to people at risk is what we are doing, because it is the, preventing transmission from one person to another is the tool that we're using right now. We wish we had more tools, but that's what we're stuck with. And so the communication is the key, and we're doing everything we can for the communication channel.
All right, thank you, Sean. And next up is Denise Clay of The Sun.
Hello, everyone. My question concerns testing in the prisons. I spoke to someone who's just gotten out of jail, and she was kind of sharing her experience with me about when she was tested as opposed to when she was diagnosed, when she was released. What kind of testing schedule are the jails on, or is there a specific testing schedule?
Our jails are continuing to follow CDC protocols and testing those individuals who are showing symptoms. Unless people are showing symptoms, we are not testing otherwise. In other words, we're not testing people who are asymptomatic.
Okay, now is there also a testing protocol for the nursing homes? Because most of the cases half of the cases of people who have died are coming from the nursing homes. Is there a protocol for testing there? I mean, in terms of how often do you test? I mean, if you're in a space where like most of your roommates have had it, do you get it, or do you just get it because you're a senior citizen and you're in a nursing home?
Well, you don't get it just because you're a senior citizen in a nursing home. You get it because you're exposed to somebody else who has the virus. So we're working with all the nursing homes in the city that have at least one case diagnosed. with giving them specific recommendations about who to test and how to handle the results. So obviously we would test anybody who has symptoms. We would test people in some cases who might have atypical symptoms, because we know elderly people in nursing homes may not have typical symptoms. And there may be some circumstances where we'll be testing asymptomatic people in nursing homes, but it's something done on an individual patient basis according to their symptoms and their exposures, to try to contain it in that facility.
And Denise, I do want to add, the reason we have these protocols are because of extreme shortages of tests, and we're trying to best utilize it to protect our healthcare system as we expect this pandemic and our response to it to last for quite some time.
Okay. Well, thank you.
All right. Thank you, Denise. And our final questioner for today, Sheikh Kirshan of Bangla News. You're up.
Good afternoon, everybody. My question is for Rebecca, Miss Washington or Brian. You know, in the Ramzan time, this is a special religious time for everybody. And basically 2 times we have a big gathering. One is after sunset, one is fasting, and other one is the night prayer. So what I understood that in that time that there's a big gathering normally happen. So you guys allow us to do praying like in a small group, or at all, not at all?
Thank you for the question. Our guidance is that everyone would stay home. So even gathering in small groups for prayer, we would ask people to figure out a creative way to do it alternatively. So remotely, virtually, until we get to the other side of this.
And let me say, from my perspective, God loves us all, and understands the situation that we're in, and will accept our prayers to God wherever we are. While I understand that tradition is important to everybody and every religion, this is an unprecedented time, and God hears us, and God will keep us safe if we keep ourselves safe.
Did you have anything further? Any further questions? All right. You're good. Thank you. Thank you for those questions. And that brings us to an end. This concludes today's daily briefing, and we will be back again at 1 p.m. tomorrow.